we're going to go ahead and get started here. I am happy to introduce our next presenter, Jeff Donagan, with, well, I'm going to have him tell you if it's Ambetter or Ambetter, or you can go by either. But very excited to welcome them here to Nebraska. And again, just as a reminder, if you have questions, we're going to save those till the end. I'll try and answer what I can. But just make sure to type those in the bottom right-hand corner, and then I will we'll come back to those here at the end of the presentation. So with that, Jeff, you're up.
Great. Thanks, Nate. Hey, can you hear me okay?
Yes, you're good.
All right, perfect. Great. Thank you very much for the introduction. And yes, this comes up a lot. It's actually Ambetter. It's a name that came up many years ago at the formation of the ACA plan, and yeah, it has an interesting origin, but yes, it is actually Ambetter. So thanks, Nate. Really appreciate it, and really glad to be with you all today. My name is Jeff Donagan. I'm the sales manager for the broker channel in Nebraska, actually the sales manager for the Western region, which includes the great state of Nebraska. We're really very, very excited to be entering the state of Nebraska with our Ambetter marketplace products of this year. I'll reference Nebraska Total Care here in just a second. Let me go into this slide that will hopefully give you all a really good overview of Ambetter and our parent company, Centene. So the Ambetter product was established in 2013. We actually, prior to that, there was a Centene acquisition of a company called Celtic Life, which those of us that have been in the industry for a while remember them as really a very large individual insurer that would work with various insurance carriers for conversion plans, also offered individual plans that were medically underwritten prior to ACA. So once the acquisition was made, I believe it was around 2007 or 8, once ACA came into play for 2014, we were really uniquely positioned. We had a core team of individuals in Chicago that were very, very familiar with individual product offerings. So they brainstormed, came up with the product, launched it first year, wrote about 60,000 members in Arkansas, and just continued to expand from there. So a little bit about our parent company, Centene. So Centene's emphasis is on government-sponsored programs. So that would be Marketplace for ACA, the Medicare plan, and also Medicaid. So bringing this home for Nebraska, we actually entered the state of Nebraska in 2017 with a Medicaid plan that some of you might be familiar with, Heritage. So we've got about 106,000 members on the Heritage Medicaid plan currently. So we're really excited for the year 2021, well, actually open enrollment 2022 here coming up, that we're entering with our Marketplace Ambetter product and also with a Medicare product as well for those of you that work in that market. Again, all operated under Nebraska Total Care. The important distinction here is that although we are a national company, we're a Fortune 25 company, we've got over 2 million members. We're the largest national ACA carrier. We have local representation in all of the states that we serve. So each state operates with its own dedicated state-based health plan. So you've got resources there in Omaha from a health plan leadership standpoint to provider relations, to claims, customer service, on down the line, all handled locally there in the state of Nebraska. So high-quality plans, certified ACA compatible plans, and again, we've been at this since inception. So a little bit about big picture. A couple things I wanted to talk about. First of all, we're really excited with our offering in Nebraska to be able to offer our plans statewide. Also, as many of you as brokers have noticed, with the increased tax credits through the American Rescue Plan, it looks like they will continue, the rulings I've seen, through 2022. That really played very, very well for Ambetter. What, let me just skip ahead here. Hang on, sorry. Yeah, okay. So when we look at our 2.1-ish million members, about 88% of those members are in a silver plan. So when I mentioned about the tax credits and the increase of the tax credits playing favorably for Ambetter, that's actually the reason why, because it really emphasized the value of a silver plan, and also with all of the enrollment that we were able to bring in during the SEP period, the actual number through August, once it was reconciled, was actually closer to 700,000 members that we enrolled nationally during the March to August SEP period. Over 50%, roughly 55% of that membership was actually driven through the broker community. We value the broker relationships. We know, especially with the increased subsidies, the value of the broker is enhanced even more, because it's about getting members to really understand the plan that they're purchasing. What is the true cost, more than just premium, looking at a plan and the deductible and the out-of-pocket maximum. And with silver, and based on where the member falls in the FPL, they can qualify for a very low or zero deductible silver plan. I put a couple of notes in here also about open enrollment. We received the final word a couple of weeks ago. I think we've known for months it was going to extend until January 15th. Also, an interesting note I pulled from one of the marketplace, the CMS bulletins that we received is it looks like there's going to be a monthly SEP for individuals that are below the 150% of the federal poverty level. So I would look for more information about that. That will be really interesting, I think, in the coming months. Quick point here about reciprocity. So although we are new to Nebraska, we're currently in 20 states, moving to 25. I've got a state map here that I'll show you in just a second, a national map. And the way reciprocity works is a really unique advantage for Ambetter and our members. So if you are enrolled, let's say you enroll with us as a member in Nebraska and you have family in Texas or Arizona and you travel to those areas, you are able to access the Ambetter plan and benefits under your plan, under your Nebraska plan, in those states, as long as you're using the network and using the terms of the plan and prior auth and all those good things that would normally exist in any of our states. So this reciprocity feature is really very unique and a huge benefit for us, more than just coverage for emergency or urgent care situations, which those, of course, are covered. But this is just allowing members really the access to coverage in all of the Ambetter states. So we're expanding into 5 new states. And when you look at the footprint here, the states that are colored in the dark raspberry, that's our official color, it's raspberry. This is our existing footprint. I need to call out California here real quick. I actually came to the company through Centene through an acquisition of a company called HealthNet back in 2016. I was working for them up in Washington State. HealthNet was an insurer in 4 western states, California being the biggest of those states. This is operated as an autonomous HealthNet state since the 2016 acquisition. It's going to be moving for 2022 as an Ambetter state, but it's Ambetter from HealthNet, and it is not fully integrated into our platform of systems and also broker channel. So this California is not, not a reciprocity state, nor is it a state that we are able to appoint brokers in at this time. I would look for this to change potentially for 2023. So current footprint, again, minus California, a bit of an outlier. And then we're really excited, again, our 5 new states. So we've got Oklahoma, Nebraska, we've got Louisiana, we've got Kentucky, and New Jersey. So that brings us up to 25 states now nationally. And then again, really excited about the fact that we're coming in and offering statewide coverage in Nebraska. All right, and this is not all inclusive. This is a brief snippet of our network. We have direct contracts with providers. We do not rent a network, which I think gives us a unique advantage. And we have, what I've tried to do here is just illustrate in Omaha, Lincoln, Grand Island areas, just some of the larger facilities and medical groups. So I'll leave this up here for just a second. All right. And our featured plans. So heavy focus on silver plans. So the naming conventions that we use at Ambetter is starting from the top. So we don't have platinum and we also don't have catastrophic. So starting at the top with gold and then moving to silver and bronze. So gold plans are called secure care. And so in the naming convention, what you'll see typically is the abbreviation for secure care plus a number from a naming convention that just distinguishes the plan design. The bold around the tile, well, they're all new in Nebraska because we're a new issuer for 2022. And again, really super excited about that. So dropping into the silver plan category, you'll see 5 silver options and then actually 5 bronze options as well. And I'm going to highlight a few of the silver and the bronze options here coming out. When you flip over here to the right side of the screen and you see product 2, what this references is, for example, on Balance Care 11, silver, the medical plan is the same in product 1 and product 2. If the member purchases product 2, they're also purchasing that plan with an adult vision and an adult dental benefit. Okay, so that's the only distinction between product 1 and product 2 is the inclusion of the vision, adult vision, and adult dental. The medical component of the plan is going to be the same between the two. All right, and moving on, let's talk about our most popular plan design, which is Balance Care 11. So nationally, this is our most popular plan. The huge benefit to the plan is really when you are working with members that are at the 87 or 94%. AV stands for actuarial value. With the cost share reduction that's in play, those members will qualify for the 0 deductible, very reasonable out-of-pocket maximums, and you can see some of the other charges here along the way. And then as it moves up the scale to 73% and also to the base plan, you can see the coverages. So quick thing about our plan summary. They are being loaded, and it's not just because Nebraska is a new state, but even if you were to look on our website right now, for example, in Arizona, which is a very established state, or any of our established states, we do not have the 2022 summaries loaded just yet. We're probably about a week, maybe 2 at the outside to having those loaded in the website. And also, when I talk about the broker portal, I'll mention how you have access to the to the plan summary as well. Hang on just one quick sec. All right, got to stay hydrated. There we go. Okay, so that's an overview of our most popular plan design right here. Again, really good coverages when you look down through the plan for prescription drugs, co-pays for most of your services like primary and specialty care visits, lab, urgent care, etc. Moving on from the Balance Care 11, when we look at the Balance Care 30 plan, this is going to be our lowest cost silver plan. Okay, so this plan design is, still has good coverages when you look, the spectrum going, I guess, really from right all the way over to left. Is the $625 deductible if the member's at the 94% actuarial value, and then NCAD means no charge after deductible. So as you can see on these services, the member does have to meet the deductible first. So think of the Balance Care 11 as the richest plan benefit-wise, and Balance Care 30 as the least rich or most cost competitive plan that we offer. And then this is a plan here that I want to focus on coming up is we've got Balance Care 31. This is a new plan for us nationally, and it's got it's a little bit more benefit rich than Balance Care 30. You can see just a quick overview here of the actual benefits. And again, a lot of the services, it's at a co-insurance after deductible. And then this plan, Balance Care 32. This plan is going to be, I believe, a really popular plan for potentially a member that's going to look at Balance Care 11, and they're going to look at that and say, wow, this is a really attractive plan. But maybe they still want a plan with copays, but they are maybe a little bit concerned about the price. This plan is going to be a very competitive option with copays. And so we listened to the market. We've had some iterations of this plan through the years where maybe it had a copay for primary care, but it didn't for specialty care, and that wasn't as well received. So this year we came out with a plan that was going to be cost competitive and also had copays. So going again from the 94% up to the base, you can see us at 94 and 87% actuarial value. You've got a zero deductible, a very reasonable out-of-pocket maximum, and you've got copays for PCP. In this instance, $0 copay for a PCP visit, and then you can see it move up the spectrum, and your copays for specialists, lab, prescription drugs, etc. So I think this is going to be a very competitive plan for us nationally, not just in Nebraska. So, all right. And then moving on from the Balance Care 32, I wanted to just show real quickly the Balance Care 30, 31, and 32, which are going to be our three most competitive silver plan options. And that way, at the 94% actuarial value, you can see just a quick comparison across the board of deductibles, out-of-pocket maximum, copays, etc. Or in this instance, it's not a copay, but you can see what the cost is for services of primary specialty care, lab, RX, urgent care, etc. And then moving on to bronze. So we have a number of bronze plan options. I'm going to highlight a few of them here. This is the most cost-effective plan, very straightforward. It's an $8,600 deductible, which is the out-of-pocket maximum, so there's no co-insurance. And everything, well, most of these services here, like primary care, specialty care, lab, etc., is going to be covered, no charge after deductible. So the member has to meet the deductible first before there's cost share here. So prescription drugs, pretty straightforward, same with urgent care. We do, however, have some enhanced bronze plans. Show those here in just a second. Okay, this is an interesting plan. It was really designed to combat a national competitor of ours, not in the state of Nebraska, that was able to offer a plan with a zero deductible, but then build the cost into the out-of-pocket maximum, and that way there's some cost share along the way. So it's got copays on your PCP visits, also on specialists, even though it's a little bit high there. But you've got a cost-competitive bronze option. But again, if somebody qualifies for a significant subsidy, we're really hoping that they're reviewing the silver plan options, because we think that those are truly the best plan options value-wise when you look at both premium and benefits. And it's got an illustration of benefits along the way that you can see here. Okay. And then this plan design, this is an enhanced, what we call an enhanced bronze plan. So it's got a relatively reasonable for a bronze plan, deductible of $1,500, $8,700 is the maximum out of pocket. It's a 50% plan. It does, however, have an RX deductible. It's one of the few plans that we offer that does. but helps keep the cost down. So again, I've got a slide here coming up that shows our formulary and how to access the formulary on the website. So really important if you're, working with members or potential members, reviewing prescription drugs to see if this would be an appropriate plan or not. And you can see the cost iterations here along the way. And we also have an HSA offering. We use Fidelity as the banking option. Those of you that are familiar with how the HSA plan works, basically all deductible based. You cannot have copays on the plan. So it's in this instance $6,900 deductible, which is also the out-of-pocket maximum. All right, and when I mentioned the product 2, it has the adult vision and the adult dental benefit included. And so this is just going to give you an overview of what the vision benefit looks like. We'll talk about provider network here in just a second when we talk about it for all providers. But you'll be able to search for vision providers and dental providers on our website. And you've got a no cost of one-time annual vision exam. You've got a $130 benefit for either eyeglasses or contact lenses. And then on the dental, again, adult dental, you've got, it says plan's got a $1,000 covered max per calendar year. It's got a zero copay for your class 1 services, your routine type cleanings and exams, x-rays, that sort of thing. But once you get into class 2 and 3, it's a 50% benefit. One of the key features, though, of the plan is the fact that there are no waiting periods. I do want to call something out here. I'm not sure, I've not had a chance to look at the network within the state of Nebraska because it's not loaded yet. So it's not, the dental providers aren't loaded, so I can't check. But I do want to share something real quick from experiences that I've learned, for example, in Kansas, where we are close to statewide, all but maybe 4 or 5 counties. And some of the rural and remote areas, really important if you're talking to members about enrolling in these plans. I'm not talking about Omaha or Lincoln or Grand Island, places like that. But in the more remote areas, you really will want to check this out to make sure that the network is sufficient. In Kansas, one of the issues that we've had is trying to continue to build out the list of contracting dentists. And it's not so much for routine, but it's for some of the major services like endodontics and periodontics. There sometimes can be issues where there's a significant distance that needs to be traveled. So just being fully transparent here and something that really should be researched just to make sure that it's a good fit. I wanted to mention that from experiences that I've learned working in the state of Kansas for the last few years here. Okay, so moving on from the dental benefit, I wanted to show, sorry, hang on one sec, there we go. I wanted to show a quick screenshot, and I apologize here. We had to redact this information because this is a live look into our broker portal. So we're working on contracting right now. Really appreciate all the patience as we got OCI set up on the agency side so then we could extend contracts to sub-agents, which we've done. We did that late last week, so you should, if you've been extended an invite, have that. And once you're contracted with Ambetter, I think one of the very unique things that you're going to find, huge advantage, is our broker portal. It is very, very robust. It will show you essentially your entire book of business. That when you look at the columns here, the policies, the coverage that the member has. Anytime you click on any of these policies, it'll go into details where you can order an ID card, you can print a temporary card, you can review payments, you can look very clearly and see the total premium, the amount that might be subsidized, and the amount that's the member responsibility. So it's all right there at your fingertips. And then some of the resources along the top that I wanted to illustrate. Just click off of the animation here. Oh, that's a good one. So quick pay. So once you're enrolling members, we really encourage you to, the brokers, of course, to encourage the member to sign up for AutoPay. It makes a lot of our lives easier. We're not tracking down, membership payments and getting them all set up. But you might get a call from a member, and they will say, "Oh, geez, I really need to make this payment. It's the 20, like today, it's 28, right? Payment's due by the end of the month. I've got 2 more days. What do I do?" There's a quick pay feature. We also put a lot of links, benefit links, here at the top. So, for example, if you're talking to the member on the phone, we know it's pretty common that they're going to ask the provider questions. So we put those links here as well. They are throughout the portal, and also the ambetterhealth.com website, which is a generic, universal website. You don't have to be a contracted broker or covered member to access the website universally. And then the other thing, too, is for enrolling a client. So we use Health Sherpa, and we do have the EDE, the Enhanced Direct Enrollment capabilities through Sherpa. We have for the last couple of years now. It's been a very successful relationship that we just continue to expand. So that's our enrollment platform, which is available through the broker portal. And then the other thing I wanted to just show real quick is on this slide right here. So when the broker logs into their portal, the thing that they'll notice across the top, I showed policies, the sub-producers. This is more the sub-producers and commissions, more for the principal of the agency. But when you click on resources, you've got training materials and marketing materials. So all of the training materials, those are going to be the things like the plan summaries. They're going to be a tutorial on the broker portal. All those great things are available here in the training materials tab. And then the marketing materials tab, when you click on that, there's a number of approved marketing brochures that we've made available that brokers can use themselves. They can also customize those brochures. There'll be a little window box typically in the lower corner of the document that allows the broker, if they have an Adobe Edit feature, they can go in, add their contact information, and actually produce those flyers and send them out. It has really, really robust information about how to market to the uninsured. What are the quick facts about Ambetter? Maybe because, again, we're a new issuer in Nebraska. The member's not familiar with us. It's got reasons to sell Ambetter, not just in Nebraska, but we've got a state customizable brochure in each of our states. Okay, and then I want to talk about the provider search tool along with our prescription drug formulary, and then a couple of very unique features. The My Health Pays is really a wonderful program where members can earn up to $500 in rewards. I'll go into that here in just a moment, along with telehealth services, which, although they became very beneficial during the pandemic, they were services that we've been offering for some time, but we did certainly ramp them up as a response to the pandemic. So the member portal. So members are able to access and create their own member portal. And we're really trying to promote this as best we can. Once the member enrolls, to be able to sign themselves up, username, password, create their own account. It's going to do a lot of great things. And we always ask our brokers to please promote this. We'll promote it in the welcome packet that we send the member. We will encourage the member to take a welcome survey. If they do so, they will get $50 loaded into that My Health Pays program, which we'll talk about in a moment. But what you can see here is a really quick overview, right? The quick overview is almost like the in the broker portal, it's a dashboard. So when you first log into the portal, you'll see the dashboard, number of covered policies, any that are in delinquency, or maybe the third gauge will be your unpaid binders. So it's kind of a similar format here, where we're going to make that information front and center. You click on the information. I should have mentioned this when I was showing you the screenshot of the broker portal. when you download the information out of the portal, you can export it into Excel. So all of the policy listings, all of that information, you'll have access to and be able to download that information for your use. So for members, we certainly, right, we want to promote the fact that we have telehealth services. We want to promote how to pay their premium, how to order an ID card if they need another one, print a temporary card, their benefit summary at a glance, so they're not having to search through the website to look and, you know, they don't have their ID card, you know, gosh, did I enroll in Balance Care 11 or which plan did I choose? It shows the deductible amounts and amounts that they've applied to their benefit plan. So it's all right there at a glance. And there's all these tabs that they can click on to, again, make payments, access rewards, check for pharmacies, check for doctors, etc. So when you access our provider search tool, we've made it really easy. Up here in the left-hand corner, you can put a variety of different types of information. Maybe you just want to look for a primary care physician. So you don't have a physician's name, but you just want to search for PCPs. In this drop-down, though, you can also choose for specialty. You can choose the type of specialist or the type of primary care physician. Maybe it's a pediatrician. Whatever the case may be, you put your geographic parameters here, your city, county, zip code, and you hit search. And you'll see a couple things here, which we think are very, very beneficial for members. It used to be that you really only got the listing of the provider and the geographic information. So this would probably be a search in a zip code that this provider is 0.9 of a mile away. But without this, which was added last year, a lot of times, especially when you're surrounded by water, it's hard to see, right? I'm really looking maybe for providers in a particular geographic area. So versus, you know, an area that might be obviously a further distance away. So we added this. We also added whether or not the provider offers virtual visits. So think of virtual visits as separate from telehealth. So we have a separate telehealth benefit administered through Teladoc, which is just an additional enhanced benefit. But these are Ambetter contracted providers that offer the ability for you to see them virtually. And also we indicate whether the provider is accepting new patients or not. And then the additional drop down from here is learn more. And when you click on that, you'll be able to see if there's any age criteria or restrictions, the gender of the provider, languages that might be spoken in the office, other locations, all of that information is accessible as well. Okay, and then when we talk about members, again, the ability when they go onto the website, so even without them being logged in, they can go in and through ambetterhealth.com, click on the particular state. Again, Nebraska is not quite there yet. We're loading our 5 new states as we speak. Should be available here within the next week, probably by, I would say, definitely the end of the first week of October, we should be good to go there. A couple things I wanted to point out. It's really important that, you know, members have access to this information before they enroll. So how do I find a doctor? How do I look and see if the doctors that I typically use are going to be covered in network? Prescription drug benefits. So I've got a quick highlight for you on the prescription drugs because, as I mentioned, we do put the formularies here. So you can click on the formulary. You can type in the name of the medication, do Control F, type in the name of the medication and see how the medication is covered. I also mentioned the rewards program. The rewards program is very, very beneficial, we think, for our members. It's a way in which to get members engaged in, you know, hopefully adopting some healthy activities, but also recognizing that we might have membership that is managing a chronic medical condition. And it's really important that, you know, we engage with those members, that they have access, so not just the healthy members, but also the members that might, again, be managing those chronic conditions. My Health Pays program works is that by adopting certain healthy activities, members can earn up to $500 in rewards. Now, it's really important, a couple of disclaimers here, and I know it's really hard to read at the bottom of the screen, but the rewards cannot be used for pharmacy copays. The reason being is with the prescription drug rebates that exist between drug manufacturers and pharmacies. That's really the largest barrier there as to why the copays for a pharmacy are not able to be used with My Health Pays dollars. But it also it's a plan in which the member can carry forward unused money in the program as long as they continuously review. And again, for participating in specific health screenings or healthy activities, this is just a small sampling of those type of things. I mentioned the onboard survey, a PCP wellness exam. I'll show you in the next slide how just right off the bat members can receive excellent benefits for that. So there's the ability to access the My Health Pays program. There's a smart app you can access through your phone, and the dollars are loaded into a prepaid debit card. So it's a Visa debit card, and the dollars are loaded for the member to use. And these are the type of healthcare-related costs that members can use that money for. You can use it to pay your monthly premiums, pay for doctor copays, deductible amounts, co-insurance amounts, monthly bills like living expenses like utilities, cell phone bills, transportation, education, rent, all those different types of things. You can use your My Health Pays dollars for. And this is an illustration of how the point and dollar conversions work. So as I mentioned, great way for us to get members to engage with us and sign up for the member portal. Gives them access to their EOBs electronically, all sorts of functionality, make quick payments if they're behind, need to catch up, all that sort of thing, which is really, really beneficial. So we're going to reward the member. On board with us, take the onboard survey, you get $50. It's loaded into the card. You can, by having a wellness exam or certain preventive screenings, you can earn up to $200. If you're managing a chronic condition, that's where the $50 bucket of money would come into play. And then the last bucket, which is up to $200, is online activities. So the member engages with us and they say, I really want to work on an exercise program or a stress management program or an eating healthy program. And what they do is they set goals. They're their own established goals that they set. And by tracking and monitoring and reporting their results, self-reporting, they can earn this additional money. So it's really a hugely beneficial program that we have. I will tell you that year to date, I'm somewhat proud of this number, but I'm also recognizing that 300,000 members is only about 15% of our membership have actually activated their My Health Pays account. So we really need to continue to promote this program. And so by doing the things like the onboarding survey and things like that coming up into this year, we're really hoping that that gives the member the launching point first right off the bat once they enroll with us to take that survey and get the $50. And then hopefully they'll then learn, oh gosh, there's all these other things I can do. Well, I'm going to go see the primary care physician anyway for a wellness exam. Might as well get the money for that and make sure that it's being tracked and reported. We have paid, though, out this year over $67 million in My Health Pays rewards. So a lot of members take advantage of it, but there's still more work to be done there. And it's also a great retention tool. We recognize that the members that activate the My Health Pays program are highly incentivized and more likely to renew with us. And this is just also, it's somewhat tied in to My Health Pays, but under the rewards tab, it also outlines the different member discounts that are available for a variety of things, like, member health club, discount, all those discounts to healthy eating services, things like that, through a vendor called Affinity, and there's the ability to have access there. Okay, just a handful of other slides here, and then we'll wrap up, leave some time here for questions. Okay, so the telehealth benefit. I mentioned earlier that with our physicians, we have the ability to recognize if they're able to accept virtual visits. So again, those are Ambetter contracted providers. If they accept virtual visits, we have it loaded on the website. And we know about it. There's an incentive, certainly from a cost and a convenience standpoint, to access virtual visits where at all possible. Along with that, we partner with Teladoc. And so the way that Teladoc benefit works, hang on one second, please. The way the telehealth benefit works is that we encourage the member to sign up for Teladoc and create an account when they enroll with us. Speaking from not personal experience, but somewhat because it was a family member that was trying to access Teladoc services when they were sick. It's probably the worst time, right? And just like it's the worst time to actually try and find a physician, find a primary care doctor when you're sick. So we encourage members to establish their own account so that it's up and ready to go, and they can quickly click on it and find a virtual provider that they have access to through Teladoc. So some of the advantages of Teladoc, you've got basically 24-hour support, even if it's not the virtual visit, it's a nurse advice line, for example. Maybe you've got a young child at home and, they're sick, they've got a temperature. You're going to want to obviously talk to somebody about that. You've got those services that are available to you. You're avoiding lines and potential exposure that you might get in a physician office visit. It's obviously looking to reduce costs overall for services that are rendered. And this is a great point here too. It's great for outlying and rural areas. So we mentioned about the state of Nebraska, which is not unique to other states that Ambetter has a significant footprint in. I referenced Kansas, very, very relevant, that we've got communities that we serve where it's not uncommon for members to travel 20 to 30 miles to go see their primary care physician or specialist. So in those instances, if there's the ability to use either the virtual or the Teladoc services, then you've got these services that are available to you. And it's a great way to access services without having to travel. And then, of course, the zero copay. So I mentioned except for HSA plans. So those on the line here that are familiar with HSA plans know that you cannot have a copay. It's an inherent rule within the plan that you cannot have services that are subject to a copay. So in the past, and it will continue, that there will be a set cost. I don't have that yet. Last year, I believe it was $45 was the set cost for the telehealth visit. So that will be announced here in the coming weeks, and we'll make that available for any member that might be enrolled in the HSA plan. All right, and then last couple of slides here, just talking about our disease management programs. We partner with a vendor called Vita, and Vita helps us with managing members with a chronic condition or maybe a mental health condition. And the way in which we do that, I think this slide here does a great job of sort of illustrating how this program works. So we might find out through claim activity or just through interaction with a member that they're managing a chronic condition. And we listed, and this is not all inclusive, but maybe somebody with a heart condition, right? Or they've got depression, or they're diabetic, asthma, different types of chronic conditions. So the goal is to get them aligned with a Vita coach. And think of that person as like their health coach. So the health coach is going to work with them to make sure that there's continuity of care, that they're getting appropriate visits. For example, they're diabetic. Did they get the retinal screening exam? Aside from being diabetic, just any other chronic condition. Do we know who the specialists are? Does the specialist know who the primary care physician is? Are they sharing medical records? Review the medication list that or the medications that the member might be taking, and what to make sure that everyone's on the same page. The providers know the medication. They're trying to avoid issues with a possible drug-to-drug interaction, and just make sure that they're accessing their benefits and that they have an additional resource. So I wanted to just point that program out. I think it's very unique and very robust with respect to how Ambetter and Centene manages this program. And then just wrapping up on post-application. So after enrollment, there'll be a reminder about the member making the payment, because as those of us here know, the coverage is not effectuated until the member pays their premium. So once they've done so, then typically in 7 business days, roughly up to 10 calendar days, we will send out both the member welcome packet and the ID card. And again, there'll be a reminder to, in this instance, since we don't have any renewal members, we're new, everyone's going to be new in Nebraska, to create a login for their member portal. And again, encourage them the letter will encourage them, and the communication will encourage them to complete the onboarding survey. In doing so, they get the $50. It's loaded right into their My Health Pays program. And then I mentioned the flyers and the resource page. So Ambetter being new to Nebraska, we've got excellent resources available at the state level. Our health plan partners at Nebraska Total Care, we've got all of the resources for claims, customer service, for provider relations, all of the infrastructure, community relation programs, all of those type of things are all available in Nebraska. I think that's a really unique advantage. So, for example, you're talking to maybe one of your existing members, or it's a potential member, or maybe somebody that's even new to the marketplace altogether, right? They're coming off of a group-sponsored COBRA, plan, or they're on COBRA through a group-sponsored plan, and they're just looking at options, right? This is a great single-page flyer, and I apologize. I know there's a lot here. But what I tried to do was copy and paste a document that was in a portrait version and landscape. So that's why it looks very busy. But in the resource tab, the top reasons to sell Ambetter for every state, including Nebraska, is there. And it gives a really great quick reminder of all the value-added services. The case management, nurse advice line, My Health Pays, the enhanced direct enrollment tool that we use through Sherpa, a bit about Centene as a Fortune 500 company. We're actually ranked number 24 on the Fortune 500 list. And just emphasizing telehealth, the fact that we cover 1 in 6, and just all of the information available there. The second page of this flyer will also have a brief overview of the services that we talked about. The provider network that I showed in a previous slide. So it's basically a 2-page document it can be downloaded. It's a PDF. And this is just really meant just so that you can see what the document looks like. And again, it's in the resource tab of the broker portal. And then I want to just wrap up talking about the broker sales support team. And then the last slide I've got here will show the actual Ambetter sales team. So we have a very robust broker sales support team that supports the marketplace product nationally. They are out of Sacramento. It's a team of 20-plus individuals, again, only dedicated to marketplace. So you're talking to an individual that is fully versed, understands marketplace, dedicated to that product line. And we make the broker sales support team available for things like researching enrollment status, make sure that membership came through on the 834 file correctly, maybe that the NPN is attached. Question about commissions or questions about resetting the broker portal. So once brokers are appointed with us, we encourage them and we help to activate their broker portal. But if there's issues where maybe the password needs to be reset or things like that, we will certainly make that available. And then over to the right side of the screen, that's really where my team gets involved. So it's the same toll-free number, the 855-700-7985, and then email is to ambetterbrokers@centene.com. For the sales team, you can certainly reach out to us through the national email box at ambettersales@ambetterhealth.com. But if you click option 3, you will enter into a sales queue for our sales team that's actually on the phone if they're in the queue at the time. Then they can answer calls that might pertain to the commission program, which has not been released yet. We will be releasing that in the coming weeks. It will be a competitive commission program. But questions about marketing collaterals or product training. If the broker selects option 3, instead of going into the sales support queue, they'll go into the broker queue. So I wanted to mention that. But more importantly, this is my team here. So again, Jeff Donagan, I'm the sales manager here, operating in the state of Arizona. I cover 6 western states. Proud to be able to include Nebraska. I've got 3 sales representatives. I want to talk about Paulina Vasquez, because Paulina is your dedicated sales rep. She's on the call here today, and that is her contact information. So she will be supporting the OCI account and the sub-agents that are contracted through OCI. So I'll leave that up. That is my last slide, other than this slide, which is just thanking you for attending. I know there's probably some questions here, so I'm going to pause. Go back to this slide. Yeah, sure thing, Nate.
Thanks again. I'm going to go through and kind of ask some of these questions. A lot of them are pertaining to network, so we'll come back to that.
Yeah.
But, is Ambetter available off market as well, or is it just on like it is in some other states?
Yeah, great question, Nate. So my understanding is no for Nebraska. Currently, there's about 8 states of our 20-state footprint that we offer off-exchange plan design. It's not common for us to do that first year in. Might be something that we do down the road, but currently there's 8 of our 20 states offer off-exchange options, but my understanding is no for 2022 in Nebraska.
Okay. When is auto draft pulled? Is that the first of the month?
Yes. Yep.
Okay. So I'm trying to go through these a little quick because I know we're running out a little bit of time. So I know you talked on your dental and vision networks. You don't have what networks they specifically use, do you? Or is that something we need to follow up on?
Correct. Yes, that's a great question. It's not. It is. Although there will be, in some instances, a behind-the-scenes vendor, the actual names of the dentists or vision providers are populated on the website. So going through the Ambetter provider search tool will get you to those.
Okay. So as far as your network on your medical plan, I thought you guys were using Midland's Choice when you got out west. Is that not the case anymore, or are you guys just building out your own?
We're building out our own. That's been that's been the emphasis from the start, which should include most physicians that are part of Midland's Choice.
Okay, so I know on that one slide, if you can go back, I don't think you mentioned CHI, or maybe we missed it. Was CHI on there?
It's not on there. Yes, we will not have CHI. So let me go back to that slide, Nate. I'll leave that one up. That's probably a great slide to leave. And again, I apologize. I want to be respectful of the fact that, we've got brokers from throughout the entire state, but I tried to highlight some of the larger counties. And,
do you know when that network search tool will be available for agents to use?
Yeah, great question. All of this by the mid part of the month. So I would say the week of the 11th is when plan designs, not that it won't be prior to that, but by that date, plan designs and network, because then we're starting to get into window shopping, will be loaded on the website.
Okay.
Hang on, I'm just going back real quick. Let me get back up to the network slide here real quick. Okay, here we go. All right. So what I tried to do here, Nate, was just grab the 4 most, populous counties in the state of Nebraska and highlight some of the larger facilities that are part of that. My understanding was we specifically targeted providers, that are part of Midland's Choice, where we wouldn't have to rent the network and pay the access fee and work on direct reimbursements with those providers, along with the others that you see here. But I do know that the CHI is not part of the network.
Okay. Let's see here. So agents will just make sure that as that comes available, we'll make sure to get that out to you so you guys can start searching for, some of those areas that I know some of you are asking specifically for. How many deductibles per family? Is it 2?
It's 2. Yep.
And are your deductibles embedded or aggregate?
Oh, great question. They are.
I believe they're embedded in most other states, but I guess we should probably just verify.
You know what, hey, Nate? That's a great takeaway. Let me check on that. I believe it's embedded, but let me check on that, and I'll respond back to you quickly on that.
Okay. Dental and vision for pediatric care, is that covered under all of your plans or none of your plans, or some?
Great call out. So I'm going to ask for a little help from you on this one. So is there a pediatric dental plan in Nebraska?
Yeah, Oscar has one, and they had just went over that earlier this morning. So they have it on all of theirs. But when I looked at most of your SBCs in other states,
Yep.
It looks like you only have pediatric vision, not dental.
Correct. And that's exactly how we handle it in every other state, and why I had to ask about Nebraska, because as long as there is a plan that has the pediatric dental, then it's not provided. But we do have pediatric vision, and that is the way it works in the other states as well.
Okay. Let's see here. We already touched on out-of-network services. So as long as Ambetter has a service area in that particular state, so for instance, Ambetter does have some providers down in Kansas, you can access those as in-network. Of course, if they're not in a particular state, you can use their teledoc or virtual care.
Correct. Yep, but absolutely, talking about the contiguous state there with Kansas, absolutely. We're not quite statewide, but we're in all but like 4 counties in the very west corner of the state of Kansas. And yes, members are able to go to Kansas, and as long as they're using the Ambetter network, they're able to access care.
Perfect. I know you can't really mention comp. I'm just going to kind of tell agents, in other states that we work with them in, they do pay a per member per month rate. We expect that to be the same. It ranges anywhere from 18 to 25. So that can kind of give you an idea of where they'll probably sit. Again, as we get that available, we will definitely get that out to you.
Correct. Yes, it should definitely be a competitive with market in Nebraska there.
Let's see. Can you go back to the slide where the member can pay their premium I think you had one where they could pay their premium over the phone and what that number is?
Oh yeah, absolutely. Sure. Yeah, sure thing, Nate. Okay, sorry about that. Hang on 1 second. Sorry, try to scroll through it quickly. Here we go. Okay. All right. I believe, let's see, was it this one or
I think it's the next one.
Yeah, I think it's the next one. You're right. Hang on. Sorry about that, Nate. Just give me a second.
You're fine.
Oh, wait, here we go. Is it this? Hang on.
Maybe there was, I know there was the broker phone number, but I didn't know if there was a client customer service.
Oh, right. Okay, yes. So the member service, that's a great question. I know the line is established. I don't have it printed out yet, let me make that a takeaway for you, Nate.
Okay.
So, yeah, each state has its own member services line. So I need to get you the member services number for Nebraska.
Okay.
Yep, I will absolutely get that available to you.
Perfect. I don't think we have any other questions at this time. I know we're wrapping up. Jeff, again, thank you so much. We're definitely looking forward to working with you. Agents, if you have not got your appointment link yet, or you still need to get contracted or transfer your appointment, please reach out to our contracting team here at OCI or your account executive. We do have an hour break before Bright Health is up. So again, Jeff, thanks again for your time. And anything else you want to leave us with?
Oh, that was my pleasure. Just that I really look forward to working with you all, and we're just very, very excited to be entering the state of Nebraska. We're really looking forward to real good things there, and our great partnership with OCI. So thank you all very much. Appreciate it.